Good evening and welcome to the National Pancreas Foundation's April Virtual Education Series. I'm going to give everyone a few minutes to continue joining, but I'm Trish O'Neill, the National Director of Chapter Development, and we will get started in just a moment. The National Pancreas Foundation provides hope for those suffering from pancreatitis and pancreatic cancer through funding cutting-edge research, advocating for new and better therapies, and providing support and education for patients, caregivers, and healthcare professionals. Some of our featured programs include the animated Pancreas Patient, state chapters that help support education, fundraising, and patient support, and our physicians programs, which include research grants, medical education, and our annual fellow symposium. Our success depends on the support of many individuals and organizations. You can make a difference by joining a chapter, partnering with us by making a donation, coordinating a fundraiser in your own community, or sharing your own personal story. For more information or help, you can reach out to us at info@pancreasfoundation.org. We hope you will follow us also on Twitter, Facebook, or Instagram to learn more about our upcoming education series, fundraising, and patient support opportunities. Our program tonight is focusing on understanding and managing the psychological impact of pancreas disease. I'd like to welcome our two hosts tonight this evening from the University of Northwestern University School of Medicine, and that is Dr. Sarah Quinton and Dr. Kathryn Tomasino. So thank you for joining us.
Thank you so much, Trish, for introducing us. And we are so pleased to be able to come here tonight to speak with you about how to manage the psychological impacts of pancreas disease. By way of introduction, I'm Dr. Sarah Quinton. I'm Director of Behavioral Medicine for GI Health in our Gastroenterology and Hepatology division. My co-presenter is Dr. Kathryn Tomasino. In just a moment, I will share my screen and we will begin our tonight's presentation. Just as a reminder, if everybody can make sure they mute their microphones when they're joining us tonight. But for this evening, I'm going to be speaking briefly on understanding and managing ambiguous loss in pancreatic disease. Now, I'm sure we are all very familiar with the idea of loss, but the term ambiguous loss might be something that you and your families are not quite as familiar with. It's important for us to talk about loss because loss can have some negative impacts on our physical functioning, our physical well-being, as well as our psychological functioning. Now, in the most basic sense, loss, grief, and bereavement are natural parts of our life and something that I think we are all familiar with and we can all understand. For the most part, loss and bereavement is usually socially understood by, physicians, our cultures, our families, our friends, and there's a lot of traditions that surround how we support people who are experiencing loss. But that's loss in a more traditional sense. For example, somebody who passes away. There are markers associated with that loss, such as a funeral and ways people go about supporting that loss. So I'm going to be talking about ambiguous loss, which is something that is fairly prevalent among those who are dealing with chronic illnesses like cancer or pancreatitis, for example. So ambiguous loss is a term that was coined by Pauline Boss in the late 1970s. And the idea of an ambiguous loss is that it is a loss that occurs without understanding. There's no real closure, and it's persistent. So it's something that just sort of keeps going. It's a situation where there are no clear answers, and sometimes that means it's very hard to make decisions or there are no clear resolutions. With an ambiguous loss, you don't have a grieving process like we see with a traditional loss. And because of this, your grief can be halted or frozen, and people can become very much stuck in a negative state of being. So another thing that happens with ambiguous loss is that individuals and their families often feel like they're in a roller coaster of emotions. They can't get their feet underneath them, and they're feeling left searching for answers. There are two types of ambiguous loss that are classified either by a physical loss or a psychological loss. Now, physical loss in the ambiguous sense, you can kind of understand it in the sense of a loss of somebody's physical presence, but they are maintained psychologically in our memories or in our thoughts. This is very prominent in situations where we see missing persons, where we have prisoners of war, where there's separation, with immigration and migration, with natural disasters, anytime there's adoption, miscarriage, stillborn, things like that. Now, the other type of ambiguous loss that I really want to focus on with you guys tonight is the concept of psychological loss, the second type of ambiguous loss. Now, this is where an individual is physically present, but psychologically diminished or absent. And what we see with this, the prime example, and where we see most of the literature for this, is with Alzheimer's disease. So where you have the physical presence of the individual, but you're forced to sort of watch them fade away because of their diminished capacities. We also see this in addiction, separation, and divorce. But also we see this in other chronic illnesses like cancer and pancreatitis. Okay? So the idea is that you sort of continuously experience losses, either loss of physical capabilities due to the illness or the symptoms, and also psychological components because of that. And we also see this form of ambiguous loss when one loses a sense of who they are because of how their abilities are changing, because of how their roles are changing. One of the ways that I like to explain this to patients is it's like an iceberg when somebody has a chronic illness. On the upper part of the iceberg, we have that forward-facing presentation that maybe our coworkers see, or even that our family sees, and that's our strong face where we're trying to present to the best of our ability, and maybe people are not aware of the pain that we're experiencing or the symptoms that we're having. And that's that bottom part of the iceberg that really contributes to some ongoing loss and challenges for patients. And that's the things like the symptoms, the financial difficulties, the seeking out medical care that others in your life may not be recognizing or seeing. So this brings me to discussing how traditional loss is different from ambiguous loss. In traditional loss is viewed as a normal experience that everybody has and every family has at some point in their life. With ambiguous loss, this is not well understood, sometimes not by the patient or their families or even your communities. With traditional loss, there's these social, spiritual, and even cultural structures that we have in place to address loss and to support loved ones and families. Okay? With traditional loss, we also have professionally established models of care. We have protocols for therapies for families dealing with the death of a loved one, whereas with ambiguous loss, we don't always have that. And with ambiguous loss, there can be a lack of professional resources to support patients and their families and loved ones as they deal with a chronic illness. Okay? Another thing that is different between traditional loss and ambiguous loss are these distinct and very clear-cut periods. With a traditional loss, you usually have a before the loss, after the loss, and then following that, you have anniversaries. And these are these real touch points that families are often supported around, either in therapy or within their communities. With ambiguous loss, these losses are not always seen by other people. They're not always marked or honored or have support structures in place around them. Now, the impact of ambiguous loss is really important to consider, and I want you to think about your own situation and perhaps what you are experiencing as a patient or what you are experiencing as a loved one or a family member of a patient with a chronic illness. What we see with ambiguous loss is we start to see people experiencing increased feelings of helplessness, perhaps feelings of hopelessness. There's increases in depression, anxiety, anger. We also see with ambiguous loss, we see more conflict in families, but also in the workplace with patients and their coworkers. And that's related to some of this helplessness and potential anger that can arise from dealing with this. We also see increased isolation and withdrawal, okay? We see burnout and exhaustion in loved ones, patients, and family members. Also, if you notice that you're feeling really unsettled or like you're on a roller coaster or you just can't get your feet under you, it's possible that you're dealing with some ambiguous loss. And another thing with ambiguous loss is it can make us feel stuck. We don't know where to turn. We don't know what our next steps are. And as I'm sure you know, being stuck is a very uncomfortable place to be. And that can also impact our ability to make decisions, to complete tasks, and that includes decisions about medical care, but even just day-to-day life decisions. Now, when we're talking about ambiguous loss in chronic illness, Pauline Boss says there's the big five or five main reasons that ambiguous loss is so difficult for people with a chronic illness. The first reason is that ambiguity creates confusion. We don't know what to do. We don't know how to make decisions when our situation is completely changing. For example, maybe you feel fine tonight. Maybe your symptoms are well managed tonight, but maybe you're wondering if you're going to feel that way tomorrow. Or maybe you have family plans in the next couple of days and you're worried in the back of your mind, am I going to be able to do that? How am I going to feel when I go out to this event? Ambiguity also disrupts traditional roles that we might have within our life. So what tends to happen is we get stuck in our family roles, despite the fact that our illness might be changing our situations. So for example, we have, children or family members saying, why can't dad, join us for this event or go to my t-ball game? And so managing that is pretty important. Ambiguity also prevents validation. The outside world does not validate the stress, the pain, or the loss that you are feeling, that the patient's feeling, that the family members are feeling. Whereas with the traditional loss, there's a lot of validation and support when you're going through that. Ambiguity also creates something we call a crisis of meaning. And this is where, because of our experiences, we may start to question our faith traditions. We may start to question our place in the world. We may begin to view the world as very unfair and unjust. And then finally, ambiguity is exhausting. Not just psychologically exhausting, but this also plays a role in physical exhaustion. When every day feels like a struggle or every day has a challenge, it eventually wears you down unless that aspect is addressed. So I think tonight, one of the big things that we want to bring to you all is this idea of how do we recognize ambiguous loss? How do we manage this? And just very briefly, the first thing to do is name it. Sit down and acknowledge, with your loved ones, with your family members. And this is not only patients acknowledging the losses they've experienced because of their disease, but also their caregivers acknowledging that they have had losses in caring for somebody with a chronic illness. Connection and support can be very critical. So having family meetings, regular check-ins, joining a support group, individual or family therapy can be very helpful to process this. Also, self-care is critical. Setting aside time for yourself to engage in, even if it's just 20 minutes, to something to take care of yourself. And then finally, this idea of cultivating resilience, which sort of is the umbrella over all of these other aspects. Now, resilience is our ability to cope or manage with a situation or a crisis that comes upon us, and to be able to manage the negative fallout of that situation. Resilience is also a process. It's not a place. It's a process of adapting well, and it involves change, it involves growth, and it allows us to weather hardships in our life. And then the final thing about resilience, before I kind of break that down for you, is resilience is not necessarily an inherent trait that somebody is born with. One person is so resilient versus somebody else is not as part of their personality. Resilience can be learned. It is a skill that can be developed through intentional practice. And how we do that is kind of through this ambiguous loss and resilience wheel here. And I'm going to move on just to my next slide because it kind of breaks that down. The way that we build resilience is to find meaning in our experience. And this goes back to naming it. Identify and name the challenges you're experiencing. Discuss the meaning of the illness for you, for your family, the meaning that this has on your life. Work to accept uncertainty. Acceptance, I think, is also one of those skill sets that we can practice our whole lives and still not get it perfect. It's a tough thing. But understanding that some things are within our control, but other things are not. We also want to encourage you to work on what we call restructuring identities, redefining family roles. How do we acknowledge that our loved one may not be able to do some of the household tasks that they used to, or may not be able to fill that role that they used to? We also want to work towards what we call normalizing ambivalence. Chronic illness is a journey. You and your loved ones are going to experience, again, a roller coaster of emotions as you go through diagnosis, treatment, confusion over options. And these are all normal reactions. We want to revisit attachment, which is, again, accepting these changes in our relationships. And then we really want to discover and cultivate hope. It's very common throughout a chronic illness for the patient and their family members and caregivers to lose hope. We want to be able to see if we can find some of these bright spots. Now, part of cultivating resilience when we're dealing with ambiguous loss, as I mentioned before, is developing self-care. And some of these self-care routines are as simple as, can we make sure our sleep is good? You know, how's our nutrition? Are we getting exercise? These are kind of these pillars of wellness. But self-care can also be found in learning coping techniques and practicing skills to help us in that moment manage symptoms or psychological difficulties. And for that portion of it, Dr. Kathryn Tomasino is going to be presenting on coping with the emotional and physical pain in pancreatic disease. Thank you very much.
Thank you, Sarah. I'm going to go ahead and share my screen now. See if I can. Go. Okay. All right. Thank you all very much for inviting me to be here. I'm excited to be speaking about different ways that you can cope both with emotional and physical pain in pancreatic disease. Dr. Quinton did a really nice job talking about this idea of ambiguous loss and how there can be a lot of negative emotions and difficult challenges that you experience when dealing with a chronic illness or an acute condition in terms of diseases of the pancreas. So I'm going to go into a bit more detail about the physical pain experience in these conditions and the role that emotions can play. And then I'll introduce two very specific strategies that you can use to improve how you respond to and cope with both emotional and physical pain. So these are two coping strategies, as Dr. Quinton was mentioning earlier. And these can not only help improve coping, but also build positive emotions, reduce pain intensity, and improve feelings of helplessness. All right. So I wanted to talk a little bit about physical pain in pancreatic disease. Between 40 to 80% of patients with pancreatic cancer report pain, and then abdominal pain is prominent in chronic pancreatitis, present in up to 90% of patients. So I can guess most of you sitting at home listening to this are like, we know. This is what we deal with every day. And I wanted to just acknowledge that this is a significant part of these conditions. For chronic pancreatitis, pain is one of the number one reasons for hospital admission in up to 93% of cases. And the experience of pain is quite variable in terms of frequency and the intensity of the pain. The most common pain experience in patients with pancreatitis, chronic pancreatitis, is this constant mild pain with occasional flares of more severe pain, with the second most common type of pain being pain-free most of the time, and then these episodes of really severe pain flares. So the experience might differ from patient to patient. And there are multiple factors that contribute to pain in pancreatic disease. And I'm not going to talk about the specific mechanisms there, but I am going to talk about what plays a role in the actual experience of pain, because all pain is felt in the brain. And the brain can turn the volume up on pain, so making pain a lot more intense, and it can turn the volume down on pain. And so we want to actually really capture ways that we can use the brain to turn the pain down and stop it from turning the volume up on pain when we can. So how is the brain involved? I tell people this, and it can be a little bit confusing at first. But so what happens with pain is that nerves in the pancreas send messages to the brain through the spinal cord. And the pain signals, as they're going to the brain, are regulated by both the spine and the brain. And there are a lot of different factors along the way that can turn the pain signals up or down, influencing what you feel, that experience of pain. Now, when pain becomes chronic, as it does often in conditions like chronic pancreatitis, there are actually changes in the brain that can lead to pain even in the absence of signals of pain from the nerves in the pancreas, which means we can have this recurrent pain and not really know what's going on in terms of the physiology, because a lot of this is happening up in the brain. And this is due to neuroplasticity or central sensitization, but really it's just kind of changes in the wiring of the brain if you think about the ways that the nerves are connected. So, as I mentioned, the pancreas is sending signals up to the brain through the spinal cord, and then the brain actually creates or constructs this experience of pain based on the signals it receives and combines these with a lot of other factors. So pain signals are combined with stress levels in the body, emotional state, what's going on around you or in the environment, and then with your thoughts about pain, memories about pain, and your behavioral responses to pain. All of these different factors can turn the pain up or down. And in fact, pain, stress, and emotions share many of the same pathways in the brain and interact together to affect pain. High stress levels can promote muscle tension and release neurochemicals that turn the volume up on pain. Difficult emotions, in particular depression and anxiety, hopelessness and helplessness, that sense of loss, they can all actually turn the volume up on pain. And thoughts related to our pain can impact pain. So when we're worried about how painful an experience or a day is going to be, if we think about how the pain is just unbearable, or that the pain will never go away, or we replay memories about the condition and how it negatively affected you, or imagine things you might miss out on in the future, all of these types of thoughts can play a role. And then finally, there are things that we do or behaviors that can contribute to pain. So when we're on guard or very hypervigilant to the pain experience, or focused on pain when we have it, these are all very normal things to do when we experience pain. We want to protect ourselves. And unfortunately, that same process of trying to protect ourselves can make the pain worse. So we want to break into that cycle. And that's what some of these strategies that we're going to talk about in a moment can really help you do. Pain obviously affects patients, but it can also affect caregivers. So seeing a loved one experience pain can actually activate similar brain regions in your brain as it can to the pain, having pain yourself. Pain in patients can actually increase caregiver stress and feelings of helplessness, and then create tension in patient and caregiver interactions. The good news, though, is that caregivers can also assist in helping patients with pain. So they can help feel more empowered, both them on their own, themselves to be a helper, and then also empower patients to help with their own pain. So as I've gone over now, the mind plays a very important role in our experience of pain. And I want to now talk about things we can do about it, because there are actually a lot of non-pharmacological interventions that people can access to help cope with pain. So things like progressive muscle relaxation, diaphragmatic breathing, guided imagery, even hypnosis, and then things like physical activity, changing thoughts about pain, meditation, biofeedback, improving sleep, and even solving problems and reducing stress. All of these different things can help people cope with pain. And today I'm going to review two specific ones. So we're going to talk today about diaphragmatic breathing, and I'll teach you how to go through those steps, and then guided imagery. And the great thing about both of these strategies is that they require absolutely no equipment. They can be done without any additional resources, although there are some additional resources freely available that we'll talk about a little bit later. And once you have an understanding of how to do diaphragmatic breathing and guided imagery, they can be done effectively pretty much anywhere at any time. The goal of both of these strategies is to provide a respite from pain and reduce the intensity of the pain that you feel, and then to provide a boost both in well-being and a reduction in stress. These are not intended to be pain cures, and I don't want to give the impression that these are standalone treatments or that I think this is one of the only things that matters in terms of pain management. We know that there are other techniques in terms of medicine and surgeries and things that you can do to manage pain in chronic pancreatitis and pancreatic cancer. But these are things that can help regardless of the origin of the pain and can also help with stress. So the first of these strategies that I'm going to be going through is diaphragmatic breathing. And I'm going to walk you briefly through how to do it. And then the wonderful people here at the NPF will send out some additional resources to help you practice. And for the second, I'd like you to consider actually taking part in this guided imagery with me today so that you can get an experience and feel really what it's like and see if this is something you'd like to use on your own when needed. All right. So what is diaphragmatic breathing? Diaphragmatic breathing is a technique that helps you shift your breath from the upper part of your chest into the lower, deeper part of your lungs by using the diaphragm muscle. This is how we breathe when we're deeply relaxed. This is how most young children breathe, actually. But over the years, our breathing shifts into the upper part of our chest, so up here. And this can actually have a negative impact on our stress levels and our sleep and can contribute to pain. So diaphragmatic breathing, when practiced regularly, can be both a stress reduction tool and also a pain management tool. And both patients and caregivers can benefit from this. And in fact, everyone can really benefit from this. So how does it work? Diaphragmatic breathing helps keep the body's stress response calm. So when we experience stress, our brain activates the sympathetic nervous system and sends our body into protect mode. Some of you might have heard the term fight or flight. And when this happens, a cascade of changes occur throughout the body that are designed to help us survive a threat, a physical threat. So our blood is diverted to our major muscle groups, our heart, and away from everywhere else, because these are the most important organs that we need in the face of threat. Our blood pumps harder and faster, and even our pupils dilate so we can see our surroundings better. We breathe more quickly and more shallow breaths up into the top part of our lungs. And this same physical reaction happens regardless of the trigger. So it can be physical pain, it can be emotional pain, it can be thoughts about an uncertain future, financial concerns, or even an argument with someone. And when we purposefully shift our breathing into our diaphragm and practice slow, deep diaphragmatic breaths, we actually signal to our body that we're safe. And in doing this, we can turn our body's protection mode off, or that fight or flight mode off. So that's one of the ways that diaphragmatic breathing works, by turning down that stress response. When we have that stress response active, it actually also increases muscle tension throughout the body, and that can turn the volume up on pain too. So that can also help with that. A second way that it can help is that diaphragmatic breathing helps release neurochemicals that decrease pain. And then finally, when we practice diaphragmatic breathing, it refocuses our attention. So as I was mentioning before, it's a natural thing that we want to do when we feel pain, to focus on it, because we want to get rid of it. We think that we focus on it, we can figure out, what's causing it and how can we find a solution. But sometimes this pain is not something that we can predict. And so focusing on it, as I mentioned before, can actually make it worse without actually solving anything. So when we practice the breathing, it refocuses our attention and moves it away from the pain. All right, so how do you breathe in this way? So when we're breathing in a diaphragmatic way, we're breathing into the lower part of our lungs. I'm actually gonna go back just for a minute. So this is the diaphragm right here. And so we're breathing into the lower part of our lungs and actually pushing this down. So this contracts downward, gently pushing on the lower part of our belly. And so our belly is gonna bubble out, okay? So we're breathing into the lower part of our lungs. The belly bubbles out. And then when we breathe out, our belly flattens as our diaphragm rises, with our chest remaining still throughout this. So if you take a deep breath right now, and when most of the patients who I teach this to come into my office and I teach them this, and I say, before we learn anything, why don't you tell me what you do when you take a deep calming breath? And almost all of them, they get really tall when they take that deep breath. They take a deep breath and their chest comes out and they get really tall, and that's called vertical breathing. We can think of it as vertical breathing. And this is what most of us are in the bad habit of doing. That actually does not help us calm down or help with pain. It actually can increase it. So when we're breathing in a diaphragmatic way, our chest actually is going to remain still. And we want to think of this as a horizontal breath. So as you'll see in this diagram here, rather than getting tall and our chest puffing out, our chest is remaining still, but our belly is going out when we inhale and then back in when we exhale. Okay, so how do you do this? How can you incorporate this into your life? The first thing is to practice. So when you're practicing, you'd want to place one hand on your chest and one hand on your belly, just like this person is doing right here. The belly should be just above the belly button. And then you're going to breathe slowly in through your nose to the count of about 3 or 4. Hold for about 3 or 4 again. And then you'll breathe slowly out. 5. Now these don't have to be exact seconds. These numbers can vary. You can do 3, 3, 5 or 4, 4, 6. It's whatever feels comfortable for you. But the key here is to have the exhale longer than the inhale. We want to breathe slowly and gently, not breathing in too pressured of a way. And then not being too hard on yourself as you get started. This is going to feel a little bit uncomfortable at first because most of us are in the habit again of breathing into our chest. So I'd encourage you to practice. Before you try to apply this to pain, practice this for about 5 to 10 minutes a day, maybe even twice a day or once a day, maybe when you wake up or before you go to bed. You want to practice until you get the hang of it and really see how you're doing. And to see how you're doing, if your chest is moving, what can be helpful is actually maybe to do it in front of a mirror. So you can see, is your chest moving? Are you breathing down into your belly? And you can also have your caregiver record you. Most of us have little video cameras now with us all the time. So you can have your caregiver record you breathing as you're practicing until you can really get the hang of it and it feels right. So again, I'd encourage you to be patient. The second thing when you're practicing this is that it's much easier to learn this if you're laying down. So if it's comfortable for you to lay down, I would encourage you to do that. Once you've practiced, the second thing to do is then apply it. So once you feel confident in how you're doing it, it doesn't feel so uncomfortable, then try to apply this. So apply it if you're in physical pain, and you can also try this in response to emotional pain. Diaphragmatic breathing can increase feelings of well-being, it can boost your mood. You can use it when you're feeling overwhelmed and stressed. Try for 5 to 10 minutes, see how you feel. Maybe that'll be enough, or maybe you need to do it a little bit longer. So that's diaphragmatic breathing. And as I mentioned before, we're going to send some resources out and some videos and apps that can help assist in learning this skill. Okay. And then now we're going to talk about the second skill, and this is guided imagery. So guided imagery uses the imagination to help form mental images that promote relaxation. And this can help shift our attention away from pain, both physical and emotional pain, and can help boost our well-being. It can often use scripts or audio, but you can also just pick a special place to think about and then use each of the 5 senses to imagine the details of that place and fully immerse yourself in that place. This is truly an immersive experience, and it helps shift our emotions and can lead to changes in the brain, because when we're having these vivid images in our brain actually tends to respond as though we're experiencing some of these things. There's some cool brain studies that show that. So even in the absence of a real environmental change, we're going through those same changes in the brain. Once you have identified a particular image or scene that really speaks to you, so we're going to go through one today, but then you can also go through different ones online, you can use this to practice guided imagery even without different audio or prompting. But that said, when pain is more intense, the guidance from audio and prompting can be helpful. So if you don't have audio available, your caregiver can also help guide you through these guided imagery experiences, prompting you to focus on a particular vivid image or a peaceful scene, reminding you of what that scene might be, and then having you activate each of the 5 senses in that scene. Okay, so if you're open to trying this, I'd like to invite you to try this with me now. And so in this particular imagery, I'm going to guide you to visit a garden. And so when you're in this garden that you're imagining, you can sit down or lay down in this garden. You can walk around in this garden if that's the most comfortable for you. And we're going to have you take in the sights, smells, sounds, and feeling of this healing garden as fully as you can. The goal again is to make this as vivid as you can. And I'll provide some details, but you can feel free to change anything. If you don't like something that I say, it doesn't have to exist in your scene. You can add things in if they're comfortable for you. There really aren't rules to this. Okay, so if you're comfortable doing this now, I'd like to invite you to close your eyes and get as physically relaxed as you can. And this will help your imagination to do its best work. All right. So to get started, just take a moment to check in and observe how you're feeling right now. Focus on your internal body. And notice what sensations are present inside in the here and now. And begin to do a scan of the body, looking for all points of sensation. You might want to start at the toes and the feet and move slowly up your body, noticing any physical sensations you have. Maybe you notice where your body's making contact with the surface of the chair or whatever you're resting on. And notice how that feels. And now imagine that a slow wave of relaxation is starting to flow up through your feet, starting at the tips of your toes. See if you can picture this and feel it. Imagine this comfortable, calming feeling of relaxation is spreading slowly, flowing into your muscles, up through your ankles and calves, into your thighs, wrapping around any area that is experiencing discomfort, and spreading deeply into it. The wave of relaxation spreads slowly up your abdomen. Maybe it flows more deeply into this part. Around your hips, your glutes, your lower back, up into your chest and upper back. Allowing you to breathe more freely and deeply. And finally it travels up through your shoulders and in your neck. Maybe your shoulders drop down as they feel even more relaxed. Into your face and your scalp. And maybe you feel tiny muscles in your face relaxing even more deeply. And now I'd like you to create a picture in your mind. It's a sunny day and you're outside, heading up to a garden in whatever way you're able to move. And as you're moving, you feel completely safe, feeling calm and totally at peace, moving along a path. And you feel a soft, warm breeze blowing. The air feels warm, but not too warm. It's just the way that you like it. And you're feeling happy and peaceful. And then you arrive at the garden, you take a look around now. Now that you're in the garden, you see that it's a beautiful garden, full of all sorts of flowers and plants, and even trees of all different sizes. The sun's shining and you feel totally safe, calm and at peace. And there's a soft grass on the ground. Look around you and observe what you see in your garden. It might take a couple minutes for this scene to come into focus, and that's okay. Observe your surroundings as vividly as possible. Is this a well-tended garden? Or is it more on the wild side? Can you see an outer edge to this garden? Or is it so vast that there's really no end in sight? And if there's a boundary, notice what it is. Is it a wooden fence? Or maybe a wall? What is it made of? Are there hedges making a boundary? Or maybe it's a more natural scene beyond the garden. Perhaps the garden leads into a wooded area. Whatever it is for you, just observe it and take it all in. And in whatever way you move, perhaps you move further into the garden, at whatever pace you'd like, and continue to explore the natural scene that you're in, noticing the various shades of green, the bright green of the grass, and the stems of the flowers and the plants, the darker leaves of some of the trees, some of them so dark they almost look black, and then in contrast, some that are very bright green. Perhaps there are colorful blossoms on some of the trees, or brightly colored flowers, or maybe even fruits. There's so many different kinds of flowers. Notice all the colors you can see. Brightly colored petals of orange and yellow and red. Different kinds of pinks and purples. And pause for a moment on the path, or continue to stay where you are, and take a slow, deep, healing breath, smelling the fragrance of the flowers and the earth on the ground. It smells so good and fresh and full of life. And again, you feel that warm, gentle breeze blowing over your body, brushing over your face. It feels so refreshing and clean. And then you notice the sounds of the garden. Maybe the breeze moving through the leaves on the trees. And pay attention to the other natural sounds you can hear. Maybe calls or songs of animals, or the birds that make a home in the garden. Maybe the sound of insects singing. Or maybe there's a source of water there in the garden. Can you hear any water trickling down? Or perhaps you can hear frogs croaking on their lily pads on a pond. All of your senses are alive in this special place. Let the serenity of the garden fill you, allowing the healing of the garden to spread into areas where you typically feel pain, relaxing any tension, allowing yourself to enjoy the sense of balance and peace and calm. and spend just another moment taking in the garden, the sights, the sensations, the smells, and the harmony of nature. You can return here whenever you would like, whenever you notice your body or mind are full of tension or stress, or your body is full of pain. You can return back to this calm and peaceful garden, restoring your body back to a relaxed, balanced state. In a moment, I'll begin counting backward from 4 to 1, and with each number, you'll start coming back into this room, and at the count of 1, you'll be fully present again. So 4, begin to move your toes and legs and feet. 3, begin to move your fingers, arms, and hands. 2, begin to move your head and your neck, and 1, open your eyes and gradually stretch, coming into a fully alert state. Thank you for joining me in doing that exercise. I wanted to show you a couple of different resources that are available online, and these will be sent to you as well. YouTube is a great place to listen to different people guiding you through meditation and visualization. And then there are these different apps: Breathe to Relax, Curable, and Insight Timer. Most of these are free. Curable is paid, but it has some free resources. And thanks again for inviting me to join you today.
Thanks all, and sorry to join a little late. Just wanted to thank Dr. Quinton and Dr. Tomasino for sort of guiding us through that. And if you're not feeling more relaxed yet, then I'm surprised, because obviously that's a very, very talented and experienced team that you're hearing from tonight and guiding us through. I think it's probably best to maybe start with the questions, and then we can sort of go on to some discussion. If you don't mind, I'll just sort of pick up a couple of the questions that are here, and you can sort of decide between the two of you who may be best to sort of address that one. The first question is very, very important, I think, and it's talking about anxiety around eating food and how you deal with that, because we know certain foods and certain times where you're eating fatty meals or even just eating in general makes you feel worse, and that can become a self-perpetuating cycle, because then we need to eat to heal our body. Can you talk a little bit about, we have obviously a great dietitian team here at Northwestern as well, how you work on that interplay between eating and its potential cause of increasing pain, but trying not to be someone who avoids food altogether? I'll throw that to Dr. Quinton first, because she gets to be the boss around here for some of these tough questions.
Thank you so much. One of the things that we know with a number of chronic illnesses is that people can become very shy or fearful around food, and then can begin to avoid eating some of those foods. There's even an eating disorder called avoidant restrictive eating disorder that some of our patients can experience. And it's not an eating disorder in this traditional sense, where somebody is not eating because they want to lose weight, or they're not eating because of body image. It's not eating or not taking appropriate nutrition out of fear of symptoms, and usually pain is primarily that. So we see significant weight loss and a negative impact on quality of life when it comes to food and pain. One of the things that we recommend is working with a therapist or working with a specialized registered dietitian who has an understanding of avoidant restrictive eating disorder, or how symptoms impact our perceptions around food and our food choices. Your best bet would be to go with a therapist who has experience in working with somebody with a chronic illness or pain, and can kind of support you as you start to expand your diet, because expanding your diet can be a very anxiety provoking time, and it's better to be supported through that. And miss anything in there, Dr. Tomasino, that you'd like to add?
I think one of the parts of the question that was mentioned is, how do I know if this is normal, and how do I know if this is an actual eating disorder? And I think that Dr. Quinton did a really nice job talking about this eating disorder and the potential to work with a therapist. But I would say that it's very common. So I think to the extent that it's normal, it's really common. You're not alone in experiencing a lot of anxiety around eating different foods. And I think that, asking yourself, is this something that's becoming problematic in my life on a daily basis? Or is it just that I get really nervous when someone brings a big pizza over, right? So there might be certain foods that are best to have in moderation. And so some of that anxiety is sending a signal to you that's helpful, right? And then there's the anxiety when it gets out of control. And now anything I eat, I don't know what to eat because everything seems to trigger my pain. And that's definitely when it's important to connect with someone and talk about that, because it is, pain comes, as we were talking about earlier, from so many different places. And sometimes we're really quick to assume that it's the food that we're eating when it actually may be other things that are causing the pain.
And Dr. Tomasino, I know you answered that question in the chat, but I think it's such an important question that I wanted everyone to make sure they got
Totally.
everyone's thoughts on it. One other question you answered in the chat that I can just direct people to is the question about specific children's resources. So if you're looking for resources for children specifically, Dr. Quinton kindly answered that as well. So that would be something you want to maybe consider looking at as well. And this other question talks about exercises to reduce pain. And so this is an interesting question because there's exercises of the brain that we've been talking about, exercises physically as well. And then there's that interplay between physical exercise and the brain. So a discussion maybe about, how do you balance exercise into this if you think that physical exercise is making you feel worse? Are there specific things you can do during physical exercise that may permit people to actually continue their exercise, which actually helps them heal and get better?
I do think one of the important things is being flexible and not rigidly adhering to, this is my one exercise. When I work with patients, I'll have somebody who's a runner. And when they lose that ability to go running, it can be absolutely devastating. So the work is like, how can we be flexible with what activities are you able to do at this point? And as symptoms ebb and flow, your ability to engage in exercise and activities can change as well. So one of the things that I encourage with my patients is to kind of have a variety of options, from more gentle, say, stretching, or something that a physical therapist who specializes in pain can work with you on teaching you those things. Even water aerobics and aquatics can be very gentle, to those more, high intensity cardio kind of exercises that some of our patients really like. But I do think the big thing is awareness of what your body is telling you at that moment, acceptance of any limitations that might be there, and some flexibility and willing to change up your routine. And then again, working with people who are trained to kind of address these issues.
Mm-hmm. Yeah, the only thing that I would add, I think that those are all wonderful points. And then it also, I think that the original person asking the question was mentioning a variety of exercises that they do participate in. And I think that one thing also to be mindful of is just listening to your body. So there might be some days when you can push yourself, and there might be some days when you push yourself too much, and that can lead to pain in several other, after that for several days. And so pacing some of those activities so that you're not going too intense. That's one of the things we work on a lot with people when we do work on chronic pain management is this idea of, oh, I feel good today, so I'm going to go all out. When maybe you'd have 2 good days if you went a little in, instead of all the way. So kind of listening to your body and not pushing yourself all the way on those good days, so you have more left for the days to come.
That's great. No, I think it's very helpful information, especially because we really want to discourage people from just avoiding physical activity, because we know that's just going to be very, very challenging then to heal.
And it can make pain worse too.
Yeah, exactly right. So this next question is interesting, and I think we want to first perhaps sort of address what the comment is. If the pain is actually in the brain, is it possible to eliminate pain 100%? And if not, why not? I think obviously we want to be clear that the pain is being perceived often because of the organ, in this case the pancreas, or the nerves around the pancreas, which happens with chronic inflammation of the pancreas. They're feeling chronic irritation. And I like to give people this example, and it's very unsophisticated compared to my colleagues, but I say there are times where you want to feel pain, right? So if you break your leg, you want to feel that pain and you want to go to the hospital and have it fixed. There are times where you have a chronic condition and you don't want to feel that pain anymore because it's under control. You're doing what you can do, or the nerves are hyperactive. And that's when we try to lessen the pain. So there's a balance that occurs, right? We can make it so you don't feel pain at all. You probably will also stop breathing. We can give you pain medicines. We can, do all these things. We want you to be able to perceive a certain amount of pain. And that's the balance that I think the team here sort of works hard on. So you want to just sort of address that in a more sophisticated manner?
One of the things that I would say is that although, pain is perceived and transmitted, to the brain, is the brain and the nervous system is such a complex system that we can't just think our way out of it. It would be absolutely wonderful if we could. But we also know that the longer somebody experiences pain for, the more sensitive their nervous system and their brain is to pain itself. So that becomes a very complex sort of system. And while a lot of our thoughts can help us to manage pain, we can't control all of our thoughts. No matter, how much work you do in cognitive behavioral therapy, or, how great you are at, identifying and reframing thoughts, we can't control all of our thoughts 100% of the time. We also know that situations that we find ourselves in can amplify pain. If we're in a stressful situation, that can actually increase our pain. And we can't always control these situations that we find ourselves in. So that's why, I personally feel that, and some of the literature shows that, like, working on the way that you think about pain and using alternative strategies, especially the way you think about pain, can be beneficial. It's so complex that that's not all that there is to it.
That's excellent. I'll answer one question, which is, the medical part of it's easy. I don't know about the other part, right? So why does the pancreatic pain seem to be much worse when lying down than sitting or standing up? Are there any tricks to relieve the pain when lying down? The pancreas is a retroperitoneal organ, which means it's sort of behind the peritoneum, which is a lining, and it tends to be more uncomfortable when lying down for that reason. And that's why you'll see people with acute pancreatitis sitting up and helping with the pain. It's sort of a classic example. Short of reducing that sort of irritation and inflammation of the lining because you're lying down, I think we have to incorporate these tricks and tips that we're hearing from our colleagues. There's a medical reason why this happens, but unfortunately there's not a easy medical treatment for it. And so things like medications as needed. So, they're not saying that you can't use medications, right? That's not the point of this. It's that everything has a role here, medications, as well as some of these behavioral medicine tactics that we've discussed. I don't know if you have any other specific ideas in terms of lying down, which is often when you're sleeping, that you can sort of give our audience.
I think that a lot of the, there was a list kind of earlier that I went through, and a lot of those strategies are actually most relaxing and beneficial when you're laying down. So that would be a great time to try some of those things if you've never tried them before, particularly if it's interfering with sleep. The goal of many of these exercises is to get in a really relaxed state, which can help with sleep. So I think that those exercises lying down, that's the best way to do them.
No, that's excellent. I think, we have the resources that have been sent out too, that will be sent out as well, which I think people will, be able to look at their own pace. This other question about, finding yourself going through phases of depression, right? Especially during flare-ups, which is, what we'd expect, right? When the disease is acting up, it's very tough physically and emotionally. So thinking about changing around medications specifically, or rescue medications when things are feeling worse, are there particular medicines that you think you need that particularly helpful that you think you could sort of talk about, or things you could do that aren't just behavioral medicine that you've seen pharmacologically may be helpful during flares to help manage these symptoms? I know it's a tough question, so I'm giving you wide latitude on how you want to answer it.
I can start, sure. I think one of the things with depression medication, not knowing the specific circumstances of the person asking the question, is that depression medications do take a couple of weeks if you're increasing the dose to kick in. So depression medications themselves aren't really the best rescue medications, but I do think that if a flare is, if there are particular times and you're working with a psychiatrist, there are certainly times to boost depression medications, and there are ways that you can do that by increasing the dose and then adding different medications onto it. But as Dr. Keswani said, yes, absolutely, we would expect that depression might increase during a flare. There are a lot of things that go along with that. It's Pain can increase depression. Not being able to do the things you can normally do can increase depression. Being hospitalized for a period of time can increase depression. So there are a lot of other ways that you can help with depression. And so I would suggest definitely talk to whoever your prescribing provider is. I think that should be something to consider, absolutely. But then considering also, what are the other things I can do? What are the things that I know help me when I'm feeling depressed? And what can I do preventatively? So you kind of have like a go-to, almost like toolbox or kit of things that these are the things you know work for you. We even have people like get actual note cards, which maybe you can do on your phone, of like a list of 10 things. These are things that I know reliably will help me. And if thing 1 through 4 isn't helping me, maybe thing 5 through 10 will. So.
Yeah, I mean, I think what you're saying is working from a menu. Sorry, go ahead.
Absolutely. Yeah.
And I think also, you know, as Dr. Tomasino and had mentioned, it's completely normal to have that experience, to have, you know, both worsening depression and worsening pain in sort of this cycle. And I think the first part of it is acknowledging that and awareness of that, because you're more empowered to address it. If you know that that is your experience and what happens, that then enables you to go to that list or start layering with maybe not, you know, we're talking antidepressant medications, but maybe, you know, some of these other self-care or other pain, you know, relief techniques that you're working on.
That's awesome. You guys are, I think the question, I have 2 more questions in the chat. I want to just sort of ask a question that I think everyone needs to understand, because we have a national audience and they'll be watching this online. This is sort of a loaded question. Do they need you, or do they need to basically follow these instructions you've given, right? So how do you tell a patient, you know, you need to come see me, you know, periodically to help work through this? And how do you decide, you know, whether there's online resources and all these things that are enough? So what's that mix for the right patient? How do they decide if they don't have the same resources locally where they are? Obviously not trying to put you out of business because you have a very important role, but can you give us an idea of what they should be thinking?
Go ahead.
Okay. One of the things that I think that has been really, that has emerged from living in this pandemic is just the outpouring of resources for people to access online. So there are lots of programs and apps that can help with meditation, relaxation, and pain management, and even, you know, managing your mood. We can add some of those into the resources that we're going to send to you. One of the things that I would say is, while it's great to kind of try these on your own and give it a shot, if you find that you're stuck, that it's not helping, that's the time to reach out, you know, get these additional resources in play. And just because you reach out to a therapist, that does not mean therapy forever. A lot of the work that we do is brief. You know, we're talking 5 sessions, maybe 10 sessions. And even in that short amount of time, you know, our patients are able to learn and apply skills and make some of these like fundamental changes. So therapy is not a lifetime commitment, but I do think kind of recognizing when it's necessary is really critical, and that's always the hard point. Yeah. Dr. Tomasino?
I would just add, I love what you just said about how it's, you know, this is short-term therapy, not what you think about or you see on TV where people are in therapy for years and years. These are things that are short-term and often skills-based. And if you have access in your area or locally, it's easy to just go in for a single session. You can decide if you want to go on for more. So, you know, if you feel comfortable enough to make the connection, we would really encourage you to do that. No one is going to say, oh, you don't need to be here. There's always something that you can get out of it, and additional resources to do on your own is something else. I
think it's key to not, I mean, if we could get anything stressed here, it's not to stigmatize this idea, right? It would be silly to stigmatize seeing you all for management of pain when we sort of clearly showed that it works, and it allows people to sort of avoid some of these other medications with side effects we really don't enjoy, and makes it harder to heal. Mm-hmm. In the interest of time, I'll sort of run through the last few questions. I think the first comment was just making sure we send out all the information. So appreciate someone, you know, obviously wanting to pass this on to people who would benefit from it. So that will be happening. Before I actually answer the last 2 questions, just a plug at all, virtual health? Are we doing that at Northwestern for this? Are, are peers doing it? Can people be seen by you all if they are not in the Chicagoland area? Where are we at on that?
That is a very complex question, and it really depends on the state that the person is in. Some states, do allow us to provide telemedicine services if they're not in Illinois, but some states are very restrictive on where you're licensed. But there's also resources for being able to find something in your community. Psychologytoday.com has a therapist finder, and that's a really nice way to kind of search for a specific therapist in your region. And the vast majority of therapists seem to be providing telemed services these days anyway.
And on that site, you can filter. There are people who treat chronic pain specifically and work with people with chronic medical conditions. You can filter by your insurance. So there's a lot there.
Excellent. Just this is a more complicated question, which I think we need to answer, which is, if you're having chronic pancreatitis symptoms, why are you feeling more discomfort in other areas like your extremities? You might find you're just sore or more fatigued and all these other things. Is there something where once you start to have a chronic pain issue like chronic pancreatitis, you become hypervigilant to other areas of pain, and how do you address that?
Unfortunately, I think that when we have what I mentioned earlier, that central sensitization, that neuroplasticity, which I mentioned is kind of like the wiring of the brain, what's going on up in there, that can make you, in general, in your brain just more sensitive to pain and pain more globally. So from the way that the brain can affect the pain, that would be what I would say. And then the fatigue in general, when you're coping with a chronic medical condition and all that's going on with that can lead to a lot of different fatigue. And if you're feeling down, that can lead to fatigue. So there are a number of things that can contribute to that kind of those extra symptoms.
And pain is very tricky in that pain very often radiates somewhere else. I know with gallbladder disease, a lot of times it's pain in the back of your shoulder patients will experience. So radiating of pain is not uncommon with a lot of conditions.
Mm-hmm.
Yeah, and I think it's a combination of things, as you said. I think that there certainly is that rewiring that occurs that luckily your techniques work more globally, right? If you do a procedure on the pancreas, it doesn't fix the extremities. But if you do something more global, as you're suggesting, that tends to work more globally. And then, just circling back around to children as we close, can someone talk a little bit about what they know about these techniques again in children? I know that we put some links in the chat, but the question has come up again about just children specifically. So anyone want to just address that?
Yeah, I'm going to jump on that real quick, and I know Dr. Tomasino's got some ideas around that too. A couple of different ways to work with that. I know with my own children, when it comes to breathing and meditation, one thing that I ask them to do is to imagine a balloon in their belly. And when they breathe in, that balloon is really expanding in their belly. And when they breathe out, that little balloon collapses. Another thing that works really nicely with children is asking your child to sit with you and to kind of hold their hands like this and to imagine a ball. And your kiddo gets to pick what color that ball is going to be. And maybe that color of that ball reflects their feelings. Like maybe it's a red angry ball. And then when they breathe in, that ball gets bigger. When they breathe out, that ball gets smaller. In terms of kind of thinking and processing thoughts, there's a really nice book called My Magical Words. It's part of a book series called Magical Me. And it's a really nice way to start introducing to children the power of language and the language that we internally use. And that using positive coping phrases can really benefit, stressful situations, pains, things like that. So that's a lovely book as well. Dr. Tomasino?
Yeah, I agree with everything you said. The only thing I was going to add is that actually it can be surprising that we think, how do we have to kind of alter this and do it a little bit differently with kids? But we use that balloon technique often with adults as well. And kids have very active imagination, so they tend to respond even better than adults in some cases and more easily. They're more open to this idea of imagining a garden, imagining like a lot of different things, imagining the ball that Dr. Quinton was mentioning. So it actually works quite well with children. It's something you can try.
But first, I just want to thank both of you. So I'm personally lucky to have you both here at Northwestern, but I think, sharing this and obviously having it now digitally shared is going to be really helpful for everyone as a resource going forward. So I'm going to personally thank you. And then I'm going to sort of bring Trish back on. I think she wanted to just say a few words, and then we can sort of wrap up and let everyone move on with their night.
Yes, I want to thank you all so much for joining us. It was such great information and very practical for our patients and families. So thank you again for sharing. Dr. Keswani has joined us late this evening, but he is our chapter medical director for Illinois. So we are so thankful for all the work that he has done to help support NPF. And we thank you all for your time this evening. As they mentioned, we will be sending out all the resources to everyone that is registered for the class tonight, and then we will also have this on YouTube as well. Thank you again.
Thank you all.
Thank you.